The honourable member for Edmonton Strathcona.
Thank you, Mr. Speaker. Like millions of other Canadians, I owe my life to our universal public health care system. In 2017, I was diagnosed and successfully treated for cancer. In the years since, I have received regular diagnostic screenings and follow-up care, thanks to a public healthcare system built on the fundamental value of freedom. That all Canadians, regardless of who they are, regardless of where they live, and regardless of how much money they have, all Canadians have the freedom to access quality, publicly delivered health care. But today in Alberta, healthcare is under attack. Jason Kenney and his Conservative government is making no secret of their attempts to dismantle the public system to which I and so many others owe their lives. In just a few months, Kenney's Conservatives have unilaterally cancelled contracts with doctors and opened the door for the corporatization of care. They have increased reliance on for-profit delivery of surgeries and are planning on spending $200 million for a private orthopedic surgical facility. They have announced the privatization of health support services, resulting in the layoffs of 11,000 Alberta workers. And just last week, they voted to support a private two-tiered healthcare system that would allow the wealthy to access publicly funded services while everyone else has to wait for care. And they've done all of this in the middle of a global health pandemic. As a result of Jason Kenney's actions, physicians are leaving Alberta and rural and northern communities do not have access to health care. In Medicine Hat, they are losing their maternity health clinic, where there are 6,000 to 9,000 prenatal appointments covered every single year, where more than half the babies born in that city are delivered. And today, thousands of frontline healthcare workers across Alberta walked off the job to protest the cuts that are threatening Alberta safety. Healthcare is in crisis in Alberta, and it is only getting worse. It should be obvious to all Canadians, especially now, that an American-style healthcare system is not the answer. If we don't understand how critical our public healthcare system is before COVID-19, we certainly understand it now. Will most of us watch in horror as thousands of Americans die every day from COVID-19 and millions lose their access to healthcare as they lose their jobs? Jason Kenney and the Conservatives aspire to turn our public healthcare dollars into private profit for his friends, for billionaires and for corporations. At this moment in time, when quality, accessible healthcare is so clearly a moral and economic necessity, at this moment in time when Canadians' lives are on the line, we should be expanding our healthcare system to better meet our needs, not allowing it to be dismantled. Too many families in Canada go without the medicine they need because they can't afford it. The diagnosis may be free, but the treatment is not. Too many families in Canada suffer because they can't afford mental health care. Too many families go without dental care until they end up in the hospital with emergency services. But instead of improving and expanding healthcare, we are forced to defend it from people like Jason Kenney. But defend it we must. The Canada Health Act is very clear. Canadians are guaranteed the right to health services without financial or other barriers. What will this government do to protect Albertans against attacks on our public health care and to protect the Canada Health Act?